DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. My friend and colleague, Dr. Manuel Chamorro, is going to be here. We're going to talk about bovine respiratory disease, some of the different vaccine research and things that they're doing here at Auburn at the College of Veterinary Medicine. Stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Manuel Chamorro, and we've known each other quite a while.
Yes, thank you, Dan, for having me here. Happy to be here and happy to spend some time with you guys.
Well, it's going to be a great show. Dr. Chamorro is an associate professor in clinical sciences in the food animal medicine area here at Auburn University College of Veterinary Medicine.
That's correct, yeah. I've been here for, I did here my residency here, and then I came back as a faculty member in 2019.
Yep, and we overlapped at Kansas State University, where we both had great opportunities, and K-State did a lot for both of us. So we're going to talk about bovine respiratory disease.
Yeah, let's do it.
All right. So let's just kind of set it up and just kind of talk about bovine respiratory disease complex in general.
Yeah, so like as probably you all know, BRD is probably the most important disease, causing economic losses to the cattle industry in the United States and many other parts of the world. If you look at, Eastern Europe, Belgium, for example, Scandinavian countries, they still, have BRD as one of the most economically important diseases for the cattle industry. So it's really a big issue. If you look, statistics in the last 30 years, despite all the research that we have done and all the advancements in understanding this condition and how to deal with, how to prevent it, the statistics show that still is really important, and some of them even say that the trendings are even getting a little bit higher, So this is kind of surprising and scary at the same time, right? Because the hit to the industry is pretty big.
It does amaze me. We have the best vaccines, the best pharmaceuticals, probably the best technology to track things, whether it's records or wearables or whatever, but yet we still.
Exactly. And then when I talk to this about producers or veterinarians or veterinary students, the reason for that is BRD, as other diseases such as calf diarrhea, for example, are multifactorial diseases. They are not easy to understand, they are not easy to address, because there is a component of management and environment that it will mess it up. It will mess it up, all your measures. It's impossible to have a clear-cut measure that is going to prevent it or is going to make a huge impact when you have all of these factors contributing to its presentation. So it's unfortunately is one of those things that it doesn't allow for preventive measures to show a huge impact.
Yeah. Well, if we mismanage the cattle at the ranch, or mismanage them at the calf ranch, or commingle them or haul them, just our marketing systems kind of set us up for failure to begin with.
Exactly, and you're right. Most of our calves, especially here in the Southeast, are multi-source and marketed through auction markets or sale barns.
Yep.
Right? So it's just that is that commingling, that exposure, early exposure, that several stops before reaching the final destination is what makes BRD one of those things that is very difficult to address.
No different than you or me. If we have multi-stops along the way, we're probably going to have some sort of respiratory disease.
Exactly.
All right, we're going to take a break. When we come back, we'll be here at Auburn University with Manuel Chamorro. You're watching DocTalk. We're glad you joined us.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian, and today I wanted to talk about some tips for managing foot baths on your operation. Foot baths are an important piece of personnel movement on and off an operation, and foot baths are something that if they're not appropriately managed can be a concern. So one of the things with foot baths that you should do is try to make sure that you knock off or rinse off the organic matter from boots before you step in the disinfectant, and then allow the disinfectant to have the proper contact time for it to be effective. And then look at disinfectants that may stand up a little better with organic load, because again, if you're not consistently managing these, the organic load in them can cause them to not have the level of efficacy that you may want.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Manuel Chamorro. We're at Auburn University at the College of Veterinary Medicine, where he serves as an associate professor and clinician in clinical sciences for food animals. He does a lot of research. He is seeing cases, and we're glad that you take time to be here.
No, we're happy to be here, Dan.
It's great.
I'm enjoying it.
Good. So let's talk about the viral pathogens, because you've been doing some vaccine research and understanding of this. But what are the viruses that are mainly associated with respiratory disease?
Thank you. Yeah. So we believe that those primary viral pathogens are actually really important, or play a very important role in the pathogenesis of BRD. You know, although not necessarily in all cases, we believe that, you know, ahead of a secondary bacterial infection, there is always a virus.
Yep.
And within those group of viruses, there is 6 that are really we need to remember, you know, and that may play a more important role in the pathogenesis of this condition. And those are, of course, bovine herpes virus 1, or IBR,
yep.
Bovine respiratory syncytial virus, BRSV, bovine coronavirus, bovine viral diarrhea virus 1 and 2,
yep.
parainfluenza 3 virus, and those would be the 6. And as we advance in molecular diagnostic techniques and understand better the ecology of pathogens participating in this complex, we are learning that, for example, influenza D virus, you know, potentially could participate. And other viruses like adenoviruses and picornaviruses may play a role. But those 6 that I mentioned first are probably the most important ones.
And you know, we've had the first the 5, the 5-way modified live viral, and now I agree with you. We're seeing more and more coronavirus, and adding that as, you know, something that we're seeing when we see some of these respiratory outbreaks and ranch specific type settings. So very interesting. So as we talk about the viral pathogens, you know, talk just a little bit about how they set the animal up then for that secondary, because we identify a lot of times these animals as being sick with BRD after we have the bacterial infection, but really there's a precursor to it.
Exactly, and some of these viruses are in general, I would say that viruses in general, respiratory viruses in general, and any of these 6 viruses are capable of replicate, like kind of multiply up in the upper respiratory tract first.
Yep.
And after they do that, what they do is kind of get that immune system really busy, and some of them are capable of going down to the lung and kind of like distract the immune response in the lung that already is, the lungs don't want to have a huge immune response because they don't want to create a lot of inflammation. So basically, some cells can grab those viruses in the lung, and then the bacteria can go down. So when I talk to producers or veterinarians about what viruses do, so I said they do essentially 3 things. One is they damage or kind of disrupt the upper respiratory mucosa and then the defense mechanisms of the upper respiratory tract. Second, they cause some sort of immune suppression and affect the immune responses, either the innate and adaptive, so immune responses. And third, they act in synergy with bacteria to allow bacterial pneumonia that is going to likely kill this animal or cause severe disease.
It's perfect. It's a great place to take a break. When we come back, we're going to talk about research here with Dr. Chamorro. You're watching DocTalk. Thanks for joining us.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
I'm Jeremy McBride. I manage the ranch for Wilmoths here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the Ferropeas has helped us. The last day we got through weaning, it was 65 degrees and sunshine, and the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 heads.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson, Dr. Manuel Chamorro. We're here at Auburn University where he serves as an associate professor. He's doing tremendous research, and it's been awesome for what you do for all of us that are out in the field. If you have a question on respiratory disease or colostrum or beef cattle health, this is the guy to come to here at Auburn. Let's talk about some of your research that you've been doing on respiratory disease and viruses.
Yeah, thank you. So I would say in the past 10 years, during my time at Kansas State and here at Auburn, we have been focusing on evaluating vaccination strategies for beef cows that would help reducing the prevalence and incidence of BRD in beef cattle in general. So my research has focused on vaccination of the young calf, towards prevention of what we call summer pneumonia or nursing beef calf pneumonia, and vaccination of the weaned calf, specifically in southeastern settings for prevention of BRD after arrival to a stocker or backgrounder unit. So what we have learned in this past 10 years, a few things. We know that immunity transfer to the young calf through colostrum. That immunity, yes, it goes into circulation. That IgG goes into the bloodstream and stays there. And those are usually specific, very, very specific immunity against viral diseases, for example. Name it BVDB or BRSB IgG, that is going to be able to leave circulation to block antigens when necessary. However, we also have learned that that colostrum IgG1 that the calf absorbs after nursing colostrum, some of that goes back into the upper respiratory tract or into the GI tract, and it stays there for a while, not too long. If you see common strategies of vaccination beef calves, young beef calves, you see people giving vaccines very early in life.
Yeah, specifically 2 to 3 months, that branding, right?
Yeah, and then even before that. So there is people that is giving the intranasal coronavirus vaccines or the typical BRSB, IBR vaccines right at day 1 of life or day 2 of life. So what we have learned is that if you do that intranasal vaccine against, BRSB or IBR and PI3 very early in life, it is likely that that IgG1 from colostrum that went back to the upper respiratory tract is going to block it, and is not going to allow like a good response. And then when you see the studies evaluating that, you see that the immunity that it generates, it doesn't last long. It is possible that we are doing it too early. Instead of waiting until that IgG1 from colostrum has decayed from the upper respiratory tract or has gone or is gone from there, so the intranasal can activate, can prime immune responses. So that's one of the things that we have learned. How long it lasts, that immunity from colostrum that goes back to the upper respiratory tract, based on our studies, lasts about 4 days. So if you are planning to vaccinate calves for prevention of either dairy or beef, I would say, prevention pneumonia early in life,
probably not going to be very effective.
Yeah, exactly. So you have to wait, and then in dairy, 3 or 4 months may be too late, right? So it is very critical to time that, the administration of that vaccine with respect to when the disease presents. So you can achieve most of the benefit. I would say that waiting a week or the week of life for prevention of BRD before 2 months likely is going to work. And we have seen that these intranasal modified live virus vaccines are fully capable of inducing specific IgA responses in the upper respiratory tract that likely are going to protect in that time frame. Mm-hmm.
So in a nutshell, doing it on day 1 is too early.
It could be too early.
And we need to delay that vaccine. When we come back, we'll talk more about the vaccination research here with Dr. Chamorro. You're watching DocTalk. We're glad you joined us.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, That's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson with Dr. Manuel Chamorro. We're here at Auburn University at the College of Veterinary Medicine. He's an associate professor and just a great researcher in clinical sciences, food animal medicine, and we're talking about respiratory disease and viruses, which as we left, which was really interesting, is that when we vaccinate too early, even with an intranasal, they can be neutralized by that colostrum antibody. So delaying that vaccination, we talk about puppies all the time. The reason why we vaccinate puppies at 6, 9, 12, and 15 weeks is sometime between 6 and 15 weeks, that maternal antibody is going to wane enough that the vaccine will actually be effective. That's what you've been saying about, hey, wait, let's wait until that. We got to wait until the vaccine isn't neutralized by the colostrum, but we don't want to vaccinate too late to where they acquire or get exposed to a disease without being protected. So that leads us to your next level of study, right? Which is preparing that calf for a change of address to a stalker or background.
Exactly. And then before I get into that, Dan, let me tell you, let me clarify something that is very important, which is that modified live virus intranasal vaccines were advocated as they override maternal immunity. Yes, they override systemic maternal immunity. They override the systemic, the colostrum immunity that is in the circulation of the calf, but they may not override specific immunity that is already from colostrum that is already in the upper respiratory tract.
And that's the reason why the good Lord in Detroit designed the calf the way it was, is so that it wouldn't.
Exactly. So, but now moving on, I mean, most of the impact of BRD, of course, is in that weaned calf, you know, that weaned calf that is changing locations, and specifically here in the Southeast, like we were talking earlier, you know, most of these calves are weaned at the truck, shipped the same day, and marketed through auction barns and sale barns, and then of course commingled and exposed several times before they reach the final destination, which is usually a stalker or backgrounder operation here in the Southeast, you know, where they stay 3 to 4 months before they go to the feedlot. We see a lot of morbidity and mortality in those operations here in the Southeast. And you know, one of our interests is how we can use vaccination to try to reduce that, you know. And what we have learned in these past few years is that, like I told you, modified live virus vaccines can really prime the upper respiratory tract to induce specific immunity against viruses, and that has worked really well for BRSV, and since they can do that, when you give the intranasal at arrival or just at weaning, hoping that the immune response is going to be fast enough to block any virus for which the calf is going to be exposed right after arrival, you know, it works, but that immune response takes a little bit of time, like 3 weeks. So you may lose the ability to actually have a significant effect. What we have learned here is when you give the vaccine, you prime the calf like around 2 months of age, which is at branding time. And then you give the intranasal at weaning or at arrival at the stalker operation. You know, since the calf has been primed, but the initial dose at 2 months, when you give the intranasal 6 months, it generates a rapid response of IgA in the upper respiratory tract that is going to block viruses. You know?
Makes perfect sense. And I think it's important too that we let people know that, you know, that intranasal is only 3 out of the 6. You know, the BVD viruses
are not there.
Yeah, and so priming those calves, you know, with BVD at branding and at weaning is also vital.
Yeah, that's a very good point. So yes, and when I talk about priming, we usually give a parenteral modified live at branding, and then
the 5-way.
A 5-way at branding, and then we do the intranasal at weaning, and we can do the parenteral, the 2-way BVDV like injectable at that time.
Yep.
You know, so yes, that's a very good point.
Great. Well, this has been a great show. Great information on vaccinating calves. Don't use day one. Wait. Get a good primer branding. Use your 5-way injectable vaccine, modified live vaccine at branding, and then if you're going to use an intranasal, we use it later in the.
Exactly. That's what we have learned here, at least. You know.
It's great. It's great information because I think we've been doing it the other way around in most cases. So keep the intranasals off the ranch, and we'll keep moving forward. Right.
That sounds good, yeah.
Thanks for being here. Thanks for watching DocTalk.
Thank you for having me.
Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. With Dr. Manuel Chamorro, I'm Dr. Dan Thomson here at Auburn University, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.